So it's a great pleasure to start the next session this afternoon. And the general theme is the pandemic response to human SARS-CoV-2. And I guess as we talked about at the beginning, there were very different responses in different countries, and we'd already talked about the contribution of Boris to the whole issue in the UK. And everyone was facing similar problems, and I guess Peter Karayiannis is going to talk about the Cyprus experience. Peter, thank you.
Let me just get the pointer on first of all. Okay. First of all, thank you very much for the invitation to speak here, including me in the program. I'd like to state at the very beginning, since quite a few of you are here from Liverpool. I studied in Liverpool. I spent 7 years of my life as a student and then as a postgraduate student because I did my PhD there, and I left Liverpool in 1980. So I graduated from the Department of Medical Microbiology as it was then, and over the years I've concentrated on virology and more or less more on molecular epidemiology. So we've done a lot of work on sort of sequencing and trying to correlate the mutations to disease progression, response to antiviral treatment, etc. So I'm going to start off with this slide, which is a snapshot of the beginning of the pandemic in Cyprus. We had the first 2 cases on March 9th, and both of these cases were imported, one from the United Kingdom and the other one from Italy. And what we call the first wave, as you can see there, it was very modest as far as Cyprus is concerned, because we acted very quickly. And you can see that before the sort of major lockdown, the government here introduced some measures in an attempt to curtail transmission. And then, of course, the lockdown followed, which was in the end succeeded by the relaxation measures which were introduced in stages. And then after the summer, we had 2 major exacerbations of infections, one in Limassol and the other one in Larnaca. And as you can see, the broken arrows there indicate that some of those restrictive measures were reintroduced, but they were applicable only in those 2 districts of Cyprus, which created a lot of annoyance with the government and, of course, the advisory committee. The advisory committee was not formed until 2-3 weeks after the first cases. So because by then I started coming on the media and talking about the pandemic, the president rang me one morning and said to me, "We are meeting, we have a ministerial meeting today, what else can we do?" And I turned around and I said to him, "Surely you don't expect me to take all this weight on my shoulders and tell you what to do. You tell me what are the capabilities of the Republic to look after hundreds of people possibly requiring hospitalization and intensive care unit attention." And when he told me that the maximum number of beds we had at that time was only 30, I did not hesitate to say to him, close the airport, close the ports, and shut down all the building sites where a lot of the foreign workers sort of work and aggregate together in very sort of crowded conditions. So we already knew that a lot of countries introduced restrictions to travel from China, and in Cyprus this happened in January 23rd of 2020. And then the other issue we had to consider is whether to close the crossing points along the dividing line between the north and the south. So 4 of those crossing points also were closed. And a couple of weeks later, countries around the world were categorized into 3 categories, 1, 2, and 3. descending order of risk of transmission of transfer of the virus to Cyprus. And of course, on the 11th, the WHO rather belatedly declared a pandemic. The government, under our advice, was very quick to assign one of the general hospitals on the island, in fact the one in Famagusta, I'll show you where that is in a minute, as the reference hospital for COVID. So everybody was being transferred to that hospital, and later on the intensive care units in Nicosia General and Limassol General were being used for patients requiring intensive care. Although I say the procurement of sufficient PPE supplies, that's not true. In the end, people had to put nylon bags as overshoes over their shoes and use other makeshift nylon coverings as aprons and what have you, just to see us through the first wave. As I said, the Advisory Scientific Committee was formed, and then the Ministers of Health and Transport were authorized to issue decrees according to the Communicable Diseases Law, the first one covering restrictions and relaxation of those, and the Minister of Transport measures with regards to aviation. So this is the map of Cyprus, as you can see. The green area is the Turkish-occupied area, the south, government-controlled area, and in fact, the hospital, the reference hospital is here, south of Famagusta, and in fact, the government also foresaw that we will need some areas where people who didn't have anywhere else to be isolated, or they needed longer recuperation periods to be looked after, and Eden Gardens was set up as the isolation and convalescence center. In addition, hotels along the coastline and in the mountains were sort of set aside to quarantine people arriving from abroad later on in the pandemic. So we started off 2 days after the first cases with prohibition of gatherings and staying in the same enclosed space of 75 people max, excluding workplaces. All events, gatherings, parades, concerts, etc. in public spaces were cancelled. Holding of football matches and other competitions without the presence of spectators also cancelled. And this is anathema as far as the Cypriots are concerned. They love their football and they feel so passionate about it.
They should have come to Liverpool, Peter.
I used to go to Liverpool football ground. Then on the 15th, entry prohibition to the Republic regardless of nationality, except for Cypriot citizens, legal residents in Cyprus, nationals employed in Cyprus, diplomats and students. Passage to Republic control areas from the north was allowed for Cypriot citizens, permanent residents and diplomats. And arrivals to the Republic, if you had come from a category 1 country, which was the highest risk, you had to go for quarantine for 14 days in one of the hotels I mentioned before. Category 2, 14 days self-isolation and self-monitoring also. On the 15th also, there was suspension of basically the whole of the economy. In other words, shopping malls, shops, entertainment venues, cinemas, theaters, libraries, sports facilities, theme parks, all these were closed, including hotels and boarding houses. And then as far as working places, only one person was allowed per 8 square meters. And we were very good at this, providing home care for vulnerable groups. In other words, there were cyclists actually doing the shopping and taking the shopping home to them. The state and private hospitals postponed all scheduled surgeries and admission so that they were ready for their facilities to be used for hospitalizations due to COVID, and non-essential visits to accident and emergency departments and so on were cancelled. Of course, these had repercussions as far as chronic diseases were concerned, particularly with cancer patients requiring chemotherapy and so on. The airports closed on March 19th, together with the ports and the building sites. There was prohibition of entry to quarantine areas, in other words, the hotels that were set aside, approaching within less than 1 meter from a confirmed case. And then it was decided that supermarkets and pharmacies should serve in the morning up to 10 a.m. individuals that belong to vulnerable groups, individuals over 60, and persons with disabilities, so that they didn't mingle with healthy individuals. On the 24th, additional measures were introduced, and this, in fact, was the start of the hard lockdown. All unnecessary movements, transfers outside for reasons as specified in a piece of paper that detailed all these things, and you had to present to the police why you should go out, were prohibited. And at the same time, access to parks, playgrounds, outdoor sport facilities, public gathering in spaces prohibited. Farmers markets, flea markets, etc., also suspended. Churches were closed, and then the operation of all retail businesses was suspended. On March the 30th, they allowed some repatriation of people who went overseas for operations or other medical treatments to return, together with students that belonged to the vulnerable groups. Anybody else who was healthy was not allowed to come back. Gatherings at homes were not allowed. Movement was prohibited from 9 a.m. at night until 6 o'clock the following morning. And on Sundays, everything was closed. Nobody could go out on Sundays. And then that's when the 2-meter distance between when you were queuing up or standing anywhere else came in. Taxis could be used up to 3 people wearing masks. And then we come to the relaxation measures. These were introduced gradually, as I said, and the intention was to have 2 weeks gap between each relaxation. This did not work out that way because with the surveillance that was taking place, we felt quite safe to start speeding up this progress. So without wasting time and describing things like that, first of all, we allowed things to open that were not risky. This opening was under the use of very strict protocols, and people who did not obey the protocols, they were prosecuted. So on 4th of May, retail businesses, excluding shopping malls, were reopened. Vulnerable groups were encouraged to stay home. One could go out using SMS at least 3 times a day. You know, people can start exercising. And in fact, the senior schools opened because it was quite near to the exam period of the students, so they had to be prepared. Then everything else opened gradually. May 21st, 23rd, as you can see, June 1st, things were speeding up. And eventually, without saying too much of this detail here, by June the 20th, the airports opened and people could come back. In fact, the students could come back because the parents wanted them to come back earlier. So gradually they were brought back, and within 3 weeks they wanted to go back to where they came from because they had exams. So it was completely pointless. I'm going to miss that one. And in preparation for this talk, I had to refresh my memory when we had the lockdowns, and I looked at Wikipedia, and I saw my name there, and you can see there, Petros Karayiannis urged people to trust the science behind the newly available vaccines and dismiss the misinformation and conspiracy theories. And then a couple of weeks later, I had to come back on again, not for the first time. We had a sort of a wave over Christmas, and we had to impose another lockdown then. And I was urging people not to meet secretly at night during the curfews. You know, there were gatherings where they used to play cards and drink and what have you. So they were spreading the virus like a wildfire. And that's one of my appearances on one of the stations. And I should say that perhaps I should go on the Guinness Book of Records. In 2022, I had 563 appearances on the media in Cyprus. So, in this picture here, I'm showing you the course of the pandemic from the beginning up to the end of 22, basically. In other words, after the appearance of Omicron over here, where we felt that things could be relaxed a bit more. So all in all, we had 4 lockdowns, as you can see here. This second one was only a 2-week one to reduce the transmissions before Christmas. We didn't want to destroy Christmas for people, but as I said, they got together, and then after Christmas, we had another spike in infections, and we were forced to close for another 6 weeks, more or less, but things were much, much more relaxed than the first lockdown. And then the 4th lockdown, 2 weeks of a hard lockdown, more or less, during the Delta period, when we felt that we had to do something about it, when for the first time we recorded nearly 1,800 cases in a day, which for a Cyprus of about 900,000 population was quite high. And then, of course, when Omicron came and we had 6,500 in a day, we just didn't bother at all. You know, everything was quite free. But by then, as I will show you in the next slide, no, not in the next slide, in a minute. The other thing we did quite well, the government here was offering PCR testing free, rapid tests free, and also the surveillance, a number of samples from hospitals and in the community were being sent for sequencing so that we can track the variants in the community. And as you can see here, this is for 2022, basically. You can see how from the Delta virus, we went to the Omicron, and then BA1, BA2, BA5. And you can see that each one was displacing the previous one and becoming dominant. The number of deaths up to the middle of last year, because the Johns Hopkins database was suspended after that, they were no longer inputs. By then in Cyprus, we had nearly 700 cases recorded and 1,330 deaths. So we did extremely good or well in preventing deaths. And this is reflected here. If you see Cyprus down the bottom, only 0.5% death rate, whilst in other countries like Mexico, for example, in the initial stages of the pandemic, that is, was 9.1, for example, and the UK is there somewhere 3.5%. And in this slide here, I've sort of summarized the deaths with The number of cases going up over time, as you can see here, okay? Now, we started vaccination in December 2020, and so when Delta came along, we already had a very good vaccination rate, above 50%. And then soon after that, once we reached 69%, Omicron came on the scene, and you can see that the death rate went down because we were not seeing any significant serious hospitalizations. This is just a resume of the very last entry into the data bank, as you can see here. So 676 million known cases of COVID, 7 million nearly deaths, and by that time, 13.5 billion vaccine doses were administered. And this is quite nice, actually, because you can see here the load from the Omicron infections when Omicron came along. And then you can see from then on, let's look at this one, which is the vaccination rate, which was already quite high worldwide. And you can see, because of that, the death rate started going down and remained down, but at the same time, the vaccination rate has dropped significantly. And the longer we leave it and people don't want to be vaccinated, if something else comes across, then we are likely to see spikes because immunity is not long-lasting. So the ministry here was issuing every week statistics. You can see here statistics over an 8-week period during the autumn of 2022. And you can see that Limassol is in pink there, which is the aggregate incidence over a 7-day period per 100,000 population. And Limassol were the not so well behaved district in Cyprus. And the same thing was done by age group so that we could see what was happening in kindergartens, in nurseries, primary, secondary schools, the community, and then in older people's home. And you can see that in the summer we start off with green and yellow, and as we got into the autumn winter, when people were enclosing themselves in enclosed spaces more and more, then a lot of the entries became pink and eventually red. So at a glance you could see what was happening. How am I doing for time, by the way?
Another couple of minutes.
Okay. Very quickly, what went wrong? Well, the Chinese authorities did not tell us early on that there was actually man-to-man transmission with this virus. We didn't understand the dynamics of transmission very well. This reproduction number of 1 is when one person passes the virus to one. With COVID, particularly as time went by, this was 2, 3, 7, 8, and there were people who were super spreaders. They could transmit the virus to 15 people, for example. Who was very slow in declaring a pandemic. Governments were completely unprepared for this emergency. There was lack of intensive care beds. I know in the UK there were makeshift hospitals being set up to deal with the emergency. The private sector initially was not involved too much in hospitalizations. They didn't want COVID patients on their premises at all. There was a black market in consumables, drugs, whatever was needed at that time. And of course, there was variable success in implementing the wearing of masks, safe distancing, and hand hygiene. The media created a lot of panic with headlines that do not pacify people, fake news on Facebook and elsewhere, Governments were reluctant to explain why the measures been imposed, and they were leaving that on us. So we were responsible for the introduction of these restrictive measures. And of course, there was an underestimation of the economic, social, and mental impact on the population because of the lockdowns. I'll skip that one, and I'll go back to this, which was extremely important, how fast we acted to create diagnostics, first of all, and then the vaccines. The genome was sequenced very quickly. Within 3-4 weeks, the Chinese sequenced the virus. They made the sequence available that enabled the setting up of diagnostic tests, first PCR, later on the rapid test for antigen detection. The vaccine, the technology was already there, produced to deal with MERS, but the vaccine was never put on the market. But it helped to prepare a vaccine quickly, and the fact that they ran first, second, and third phase trials in parallel made the availability of the vaccine to the public very quick, which created a lot of suspicion to people who were not well informed. And then, of course, there was inequality in the distribution of the vaccine. The rich got it first, the poorer countries second or last. There were obstacles as far as demand, wastage, access, supply, hesitancy, and so on. And then we were all asking, why can we test for antibody? And still, we don't know whether antibody testing would have helped in any way. And finally, I'd like to leave you with this question, sobering question. Will we be ready for the next epidemic pandemic based on the COVID-19 experiences? Well, judging by the fact that the governments have taken the beds back, put them into general circulation, disbanded the intensive care units, reduced the number of beds again, I've got my doubts. Thank you.
Thank you, Peter. That's great. Have we got any burning questions? Yes, Volker.
Yes.
So the setting is quite unique here. So 2 questions. Obviously, you had a lot of success, I would say.
Yes.
At the time, did people, were they agreeing to the measures to some, because the majority in most countries was promoting the measures at the time. Now, the second question is, when people look back now, do they still think about this the same way, and would, yes, as you said in this question, would they be open and,
yes,
and yeah?
What you said about Cyprus is correct. We are an isolated island, no borders with any other countries except the north here. That's why we closed the crossing points so that we had more control. The people were scared initially. It was something new, so they obeyed. No problems during those 5-6 weeks. A lot of people are still scared, but the others, they have forgotten about the necessity to protect themselves. And this goes for the people who belong to the vulnerable groups too. They are not particularly careful. Now, if you are asking me whether if there was another emergency, whether they would be willing to obey again, my answer is no. You know, talking to people, they say to me a lot of the times, do you think it was necessary? And I said to them, if you knew what I knew, you will realize how necessary it was.
Thank you. I think in the interest of time, we're going to move on, but we're going to have a panel session later, and you're part of the panel, so I think any other questions, if we can... Oh.
Hi. Well, I'm going to wear my HIV activist hat and ask Petros, in regards to the resemblance between the HIV epidemic and the stigma back in the days, compared to the stigma and the narrative that we heard during COVID. Do you think that there were any resemblance of the language and maybe the stigma that was produced during the first days of the COVID epidemic? Thank you.
At the beginning of the pandemic, there was a lot of stigma, actually, particularly when we were having repeatedly positive tests, more than the 15 days of the quarantine. Some people were positive for 62 days, and we kept them isolated in flats for that period of time. A lot of them were getting in touch with us feeling suicidal, and people that they knew about them, they just wouldn't get anywhere near them. And the same thing was happening at the workplace. If somebody was positive and went back to work, they were regarded as pariahs. You know, people stood away from them. So yes, there was a lot of stigma, but not to the same extent as in the HIV situation.
Thank you. Thank you very much, Peter.